She was busy traveling and doing what she does. And I'm sure she's got some updates for us. But, of course, she's with us today. That's right.
Yes, ma'am.
Footsteps for Life on the fourth Saturday, generally, of every month. You will hear Dr. Richmond right here again on May the 25th.
Yes.
But right now, we want to say good morning to Dr. Richmond. She is our local podiatrist and foot specialist, and she's going to give us great information about the feet today. Hey, Doc, how are you?
I am blessed and highly favored. I am full. I am full of the Spirit. I just came from my church, the Revival Center Ministries.
Where the illustrious pastor
is Pastor Paul Mitchell.
All right.
Yes, the most fabulous pastor in Dayton.
All right. And of course, we are excited because Revival does have a broadcast here on WDAO, which you can hear every Sunday morning. So we're excited
now
about
he's
that.
Streaming live too on Facebook as well.
That is
so
fantastic.
We're coming into the new times.
So tell us about your event today with Revival.
It was our Women's Day brunch. So that was real fun. I unfortunately had to leave to come over here to the radio station, but it was real fun. All the events at Revival Center always are beautiful, always very planned, well executed events.
Awesome.
And I always look forward to everything we have at Revival Center.
That's great. And of course, you had to leave, but you had to come in and share with the listeners some great information about the feet. You've been traveling. Tell us a little bit about your trip.
Well, I went to Columbus. We actually had a workman's comp convention for medical professionals for the entire state of Ohio.
Wow.
And of course,
how did that go?
It was very enlightening. With what's going on, especially in the state of Ohio and especially in Montgomery County with our drug epidemic. We had a lot of talks about the drug epidemic. One thing that I found very interesting was we had a retired DEA agent. And he said that The Wire was an awesome explanation of the drug epidemic, except the demographics were wrong. The average drug abuser in America is a white person. It's not an African American, and it's not a Hispanic. It's a generally
contrary to popular
it's generally a Caucasian woman. The average person that overdoses in America right now is probably between the ages of 30 to 45. Caucasian women, they're usually overdosing on like lorazepams, pain meds, and other meds, combo drugs, because a lot of people don't understand that lorazepam, which is like an antidepressant, and the pain medications. So is that
along the lines of Zoloft and those kind of things?
It's in the same class.
It's in the class, okay.
But if your drug ends in PAM, and then you're taking a pain medicine in addition to that, like a Percocet, Vicodin, Oxycontin, morphine, you have a strong chance of overdosing because those two drugs slow your breathing rate. So when people say you've overdosed, basically you just stop breathing. So, and then they come in with the Narcan, hopefully, and the Narcan instantly reverses that overdose. But if you overdose where someone's not around you with Narcan, then that's when they die because they just stay asleep.
So was there much conversation about the Narcan? Are they still wanting certain facilities, of course, schools to stock Narcan? Or what's
it was more targeted to physicians, nurses, more to let us know that the DEA is coming more after the physicians who write these drugs.
I see.
So, as what's happened recently in our news here in Dayton, Ohio, with one of our local physicians, they're just educating us on we are being monitored. So there is no, I guess there is a attachment to that drug. Like one of the titles was "Your name is on the bottle." So everything we write, our name is on that bottle. So if we give a medicine to a person who overdoses, when they come in that house, they're going to see our prescriptions there, and then they're going to ask us, "Why did you write this?" or "Why did you write it in this combo?" or "Why weren't you monitoring it?" And they're not. Well, yes, they have charged physicians with murder. Not many, but they have in certain states been able to charge physicians with murder. So it's something as a physician we have to look at diligently. Like one of the medicines that they're watching now is gabapentin, which
Now, is that the needle,
It's for neuropathy, for nerve pain.
Mm-hmm.
But after the opioid epidemic, they told us, stop writing narcotics, write gabapentin for pain, and that helps with pain relief. Well, lately, they're starting to find people who are overdosing on fentanyl and heroin are taking gabapentin with it. So it potentiates the high. It gets them higher for longer.
Wow.
And then also it helps them with the withdrawals if they can't get their street drugs. So now people are overdosing and they have gabapentin in their system. So I write a lot of that. So now I had to change the way I prescribe and monitor because they're telling us it's not a scheduled drug, which means we don't have to give you a paper script, but it is being monitored by the DEA, by the medical board. And the medical board is monitoring us. So it's just the signs of the times. I mean, if you watch the media, it gives you the misconception that it's an African American problem, but it's really a white America problem. And not to be racist, but when it went more into that community, then it became an epidemic. You know, when the crack epidemic was, there was no Narcan. And one of my patients mentioned that to me. He said, when there was crack, when we were having crack, I don't remember Narcan. And then I thought about it. I said, I don't remember Narcan either.
Right.
So, I mean, it's a different signs of the times. You know, you just have to monitor. And then another good thing they mentioned was lock your drugs up if you have kids in your house. Because most kids who get drugs,
or even visiting friends or relatives,
yes,
if you keep
they
it
get,
in your
but
medicine cabinet.
But most of your kids who get drugs get it from their parents. They go into their parents' cabinets. And then he also said, sending your kids to public school is better than private school. There's more drugs in private schools. Putting your kids in sports increases their chances of doing drugs because they pass and share their drugs. And then they're in that sports competition mentality, so they're trying to compete, you know, so they're taking drugs to give themselves a leg up. What else it was a very interesting talk. I mean, and then he showed a picture of all the drug addicts that have passed, and he showed Prince and Whitney Houston. Then he showed
Michael Jackson.
Yeah, Michael Jackson.
Right?
He showed, I forgot, it was a big football player, Robin Williams. You know, people you didn't never thought of as addicts, but they were drug addicts. And
so what's the message, Dr. Richmond, to those that are prescribed these medicines and then...
the ones that take it.
That's right, the ones that take it. And then what's the message to those that don't get prescribed it but have access to it?
Don't take it. I mean, it's a gateway drug. Like, they talked a lot about dentists. Dentists is probably one of the largest groups that they said tend to lead to addiction because the dentist will pull your tooth and give you 30 pain meds. Most people in general are out of pain in 2 to 3 days. So they may either sell those, pass them on, share them. And a lot of people, what's happening is they'll get on these drugs, they'll get addicted. They said it takes 2 to 3 days to become addicted if you have that type of personality. And then generally what happens is they go back and they can't get any more, and then they go to the street. So then they're going to the street, going for heroin, because that's the same class. And then depending on the quality of their drug dealer, whether or not he's truly giving them heroin or if he's giving them fentanyl. And then some drug addicts actually want fentanyl. But then fentanyl, it's like a dust of fentanyl, can kill you. So it's an epidemic because of the way it starts. It starts with a prescribed medication. Then they get addicted, they can't get any more, and then they go to the streets, and then maybe they'll get pure heroin, or maybe if their drug dealer's cheap or whatever, his source, he's giving them fentanyl, and then they may survive or they may just overdose. So it's just a bad situation. They said Ohio is coming back. We're doing quite well as far as recovering from the epidemic, but now the government is coming more after the physicians and holding us more accountable for what we write. We can no longer say we didn't know. They're telling us, stop. stop writing this drug, stop writing these combos,
So
stop
then
giving this
does
much.
that put the physicians in a position to where they have to really scrutinize their files and really
Yes.
go into detail of, okay, does
Yes.
this person really need this
Yes.
medicine? And
Yes,
how
we
can I
do.
make sure that they're really taking it?
Well, it does. I mean, there is a national program. Each state has a program where we track scripts. We can track scripts nationwide. So we have a program in Ohio where we can track prescriptions on, like, I think it's within a 1 to 2 day real time, where they're getting them filled. If they're doctor shopping, pharmacy shopping, jumping cities, states, because we sit on so many borders here. So we sit on the Indiana border, we sit on the Kentucky
Yes.
border, and then we're in major cities, so they can just drive, and then a lot of times addicts don't know, but they all have kind of similar telltale signs and stories and affects, I guess, attitudes that as soon as you walk in the room, or their pain is out of proportion, or it's not explainable. I'm in so much pain. You can't touch me. You can't look at me. I'm like, no. Especially if they're a new patient.
Okay.
And then we look at their ORs, which is the way we can check, and we're like, oh, they've been to this doc, they've been to this pharmacy. So they hold us accountable to check all of that and not just assume the story is true.
Okay.
So, yeah.
So you came away from that conference, of course, as you always do, well informed and even increased knowledge, but also with awareness that, you gotta watch things a little bit more.
Well, especially with what's just happened here in Dayton, it's not a fairy tale. And knowing this particular person personally and working with him over the years, it's not a hearsay story. I know, we're a very small knit, tight community of physicians, because we've had an organization where we used to meet weekly and talk and see everybody and talk to all our different colleagues. So it's very scary for a physician, any physician now, because we see what will happen. It's not if, maybe. It's an example. So, we have to think about that. But I think also it's changing healthcare and the evolution of healthcare. When you look at other countries, like they were mentioning in the talk, if you go to England and break your leg, you get ibuprofen. You get no pain meds. But it's because of pharmaceutical companies who recently have been indicted and charged that were pushing these drugs and telling docs in the past it was safe. Telling docs they weren't addictive and pushing them to write all the Oxycontins and all those different drugs. And then 10, 20 years later, then it just exploded. And then the DEA and our pharmacies and our bodies told us to stop writing it. And all these people who were then addicted went to the streets. And then they all went to heroin. And then we had a bump of fentanyl coming in, I guess they say from Mexico and China. So then people who couldn't get heroin, and then fentanyl's cheaper than heroin, so then the drug dealers started mixing or cutting their heroin with fentanyl, or they went to straight pure fentanyl.
So what message does that leave then for those, Dr. Richmond, that really need these prescriptions to survive? What message does that send to them?
They really need to work closely with their physicians. They really need to look into holistic options for their pain management, like
alternatives.
Yeah, like physical therapy, chiropractors. There's so many other ways to treat pain. Like there's now compounding medications where the medication is in a cream and it's topical, so it doesn't go through your bloodstream. It's yoga, it's it's Pilates, it's naturopathic things. There's meditation. It's anything but taking a drug that can eventually addict you or kill you. I have chronic back pain. I've had a bulging disc for 5 years in my back. And my best friend she was a neurology resident here. And I talked to her and she told me, no pain meds, no surgery, figure it out. So I started off with tinge in it. That didn't really work. I did try some of the nerve pain medications. Side effects were too bad. And someone told me about Pilates. So I've been doing Pilates twice a week, I think about 5 years.
How's it working out?
Oh, as long as I do my Pilates, and I also see a chiropractor for my back too. I do my Pilates and my chiropractor. Oh, and I get a full body massage
That
too.
Helps. That always helps.
And I mean, as long as I keep that regimen up, I'm fine. And I'm not. And like she said, you cannot have surgery for your back. Probably at least I wouldn't let you have surgery until you're in your late 50s, 60s, if you need it still. But, and then of course, when you talk to surgeons, they can't give you a timeline. They're like 3 to 6 months. Well, I own a business. I can't be down
3 to 6 months.
3 to 6 months.
Right.
So that wasn't an option either. But I mean, I had to make the decision, and this was 5 years ago. So we were in the beginnings of all the issues. So I made the decision, I'm not going to take these meds. I'm going to figure out a way to be pain-free without narcotics.
So proactive.
Yeah.
So you mentioned that happens a lot when you've visited Cuba, and you'll be going soon, right?
Hopefully, the president is not getting along with Venezuela, which is something going on with them in Cuba. So,
So that might be on a brief hold.
Well, yeah, we'll know by then. That's in October. Hopefully, that'll be quiet.
You mentioned they're very proactive there.
Well, yeah, they're very holistic,
They're
too.
holistic. Okay.
Yes, they're very holistic. They use chiropractors. They actually train, like, their physical therapists. I don't know, as well as their physicians. I think more of their physical therapists on Eastern medicine or Western Asian medicine. So they use a lot of Asian medicine, more of the holistic medicine for treatments, physical therapy, pain relief. And I'm pretty sure they didn't really ever talk about pain medication. But of course, they don't have pharma and pharmaceutical companies in Cuba like they have here. Because actually, they mentioned only in America, pharmaceutical companies are allowed to run commercials. Other countries, they're not. And I thought about, and she actually talked about how a patient will see a commercial and go to their doc demanding that drug just because they saw a commercial. And then I started watching TV and realized how many pharmaceutical, commercials come on our TVs and how much, I actually just spoke on drug costs a couple weeks ago on TV. And we were talking about the cost. I mean, drug costs are just going through the roof. And only in America, if you can buy the exact same drug in Canada or Europe, probably a fifth of the price. But in America, for some reason, they have free reign with our medicines and healthcare.
Wow, that is very, very interesting. And we know that you often attend these conferences and things. Anything coming up anytime soon in the next?
Well, I'll be going to our national conference in Columbus. That's for just podiatry, but I'm sure we'll have some more good talks. But right now, our main issue pretty much across the country is the drug epidemic.
Okay. So tell us, Dr. Richmond, of course, we should mention you are Facebook Live.
Yes, I am Facebook Live on, I think it's Tanisha Richmond at Facebook, or Richmond Foot and Ankle at Facebook.
And those Facebook gurus will find you.
Yeah, they'll Google me.
Find you. Dr. Richmond is from Richmond Foot and Ankle Clinic, for those of you that are tuning in for the first time, and that's her office is located at 1323 West 3rd Street. We know that's West Dr. Martin Luther King Jr. Way here in Dayton, just 1 block west of the WDAO studios. And of course, you can reach her at 937-228-3668. Email her at richfeet1, and that's the number 1 at gmail.com. Visit the website at richfeet.org. So what's new going on at the office?
Well, actually, I'm actually working with a physician, Dr. Kamal Marar. He's an interventional radiologist, a vascular surgeon, and we're actually working on starting a new nonprofit called AmpuStop, which is geared to prevent amputations in the lower extremity. Can
you tell us a little bit about it? Just a little bit?
Yeah, sure.
Awesome.
Well, it's basically a nonprofit organization to educate people on preventing amputation. So a lot of people don't know that smoking is bad for you, not just the cancer and the commercials you see where people get half their face cut off from having cancer or lung cancer, but it also damages the blood vessels in your entire body, but especially below the waist. I've talked about it before. So when you come off, the vessel that comes off your heart is about the size of or the width of a garden pipe. But by the time those vessels reach your foot, they're about the width of the tip of a pencil. So any kind of clots or blockages or decreased blood flow could be catastrophic below the waist. So smoking tends to make those vessels harder. It tends to make the vessels become lined with like calcium, plaque. Even if you have high lipids or high cholesterol, fats and different things will, attach to the walls of those vessels. And then also diabetes. Diabetes damages the vessels as well. Also damages your nerves. So it goes after. Diabetes actually is more deadlier to the body than cancer. More people die annually of diabetes than any other disease. So a lot of people don't really understand that because the media tends to concentrate on their favorite diseases like breast cancer and other diseases, but actually diabetes is one of the deadliest ones.
So we should watch our diet.
We should watch our diet, and especially once you become a diabetic, you need to watch your diet, accept your diagnosis, learn how to eat, learn how to change your diet and your lifestyle, because it's not a diet. Like I'm diabetic now for 16 years. It's a lifestyle change. It's a mindset change. You, just like I came from the brunch, So
there were certain things I'm sure that you knew, you better not touch that, Doc.
Yeah, or I knew I have to give myself some extra units of insulin within minutes of eating it, or I didn't eat it. So, but I mean, being a diabetic, you have to learn how to think that way and not, I guess, deny your disease.
So when we're going to take a short break, and listeners, you can give Dr. Richmond a call. Anything relative to the feet, she will be happy to address today and answer any questions, or if you have a comment, give us a call at 937-457-1210. But Doc, when we come back, can we talk a little bit more about diabetes and some of the warning signs that people can look for in the pre-diabetes stages, and then some of the ways that we can do corrective measures for that, like eating right. So we'll be back in just a moment.
Hello, this is